When I arrived at my office on January 9th of this year, I had an alarming 47-page fax waiting for me. One of the well-respected primary care physicians I work with sent me a notice at Medicare Center over the weekend. It stated that she had to repay over $2,300 within 20 days, otherwise she was going to be charged 10.875% interest per month, and future payments for current services would be decreased until the debt and interest had been paid off. Thinking that it must be an error, I called Medicare. I was in disbelief when the agent told me that due to the Affordable Care Act, which was passed on March 23rd of 2010, Medicare had retroactively adjusted its fee schedule for services provided from January 2009 to June 2010, and they were taking the money back. This means that despite the fact that we had a contract and provided services according to the contract, the government decided that they didn't like the terms and changed them after the fact. Now imagine if you or I went to the grocery store and tried this tactic. Imagine if we said we wanted money back that we paid for groceries that we ate and consumed over 2 years ago, and we were charging interest, and until they paid us that, we were going to take free food. We would either be laughed out the store or hauled away to the insane asylum. As citizens, we have to act before it's too late. We have to tell our congressmen and women that we want this destructive moving train known as the Affordable Care Act stopped in its tracks before it destroys medicine altogether. Today, I'm going to tell you what I've seen the Affordable Care Act do firsthand, what will happen once the act is fully in effect, and how to stop it before it's too late. First, we all should be aware of what is happening to providers because of the Affordable Care Act. A report published by the U.S. Department of Justice states the Affordable Care Act provides $350 million of additional funds to help fight Medicare fraud and abuse. Now, while this initially may sound like a good thing, especially when the report also states that $4 billion in taxpayer dollars was recovered from payments that shouldn't have been made, what it doesn't tell you is that it will not retain the entire $4 billion that was recovered and may even end up costing the government an additional $560 million in expenses after providers exercise their appeal rights. You see, the government insurances use a pay and chase tactic with claims. This means that even if a claim has a billing error, it may be minor, or if it was obvious fraud, it still is paid. No other insurance company uses this tactic for paying claims, which is why no other insurance company has this big of issue with fraud and abuse. Most of that $4 billion the fraud enforcement team claims to have taken back are for small administrative billing errors that occurred due to the complex, ever-changing Medicare billing rules. This is not fraud and abuse. I also work with a prosthetic company that has been providing prosthetic care to Oregon patients for over 100 years. They recently had $32,000 in claims taken back for services they provided in 2008 to 2010 because they forgot a 2-digit modifier code on the claim. They now will have to go through a lengthy appeal process to get back the money that was rightfully owed to them in the first place. The 5 levels of a Medicare appeal process took an average of 14 months in 2007. In 2012, the Office of Health and Human Services estimates that it could take approximately 42 months to now complete the 5-step process. This has been contributed to an increasing number of provider appeals, appeals being filed by providers. So as you see, the Affordable Care Act is not so affordable to providers. The administrative burden of the timely and costly appeals, the extreme reduction in fees, has caused providers to choose to stop seeing Medicare patients altogether. The Boston Globe reports that primary care physicians took a 27% decrease in Medicare fees in 2012. Because most practices see at least 40% Medicare patients, this impacts everyone, not just seniors and the disabled. One of the nation's largest states, Texas, reports that prior to 2003, no more than 3 providers would leave a Medicare panel a year. Within the last 10 years, it has reported a 3,000% increase in physicians leaving the Medicare panel. Personally, I have seen 4 out of 8 doctors I consult for choose to leave the profession in the last 2 years because of the Affordable Care Act. Statistically, if this pattern continues, we will not have enough primary care physicians to treat any patients, not just Medicare patients. Healthcare analysts have estimated this could cause a severe shortage in care, especially in rural areas. Next, let's take a look at what's to come. In 2014, 19 new provisions will become effective under the Act, but there are two that concern me the most. First, everybody will be required to purchase health insurance, and if you don't, you will be fined, and the IRS will be enforcing these fines. This is the first time in history that the government has forced us to buy something from a private business. Currently, the Supreme Court is deciding whether or not this mandate is even constitutional. Second, private insurance companies will have to accept anyone that applies for insurance. So while the government turns to tax dollars to fund their health plans, private insurance companies don't have that luxury. They simply cannot pay out more than they collect in premiums, otherwise they become insolvent. Because private insurance companies will not be able to turn down these individuals, and there's going to be new fees imposed on insurance companies in 2014, the expense is going to get passed down to the consumer. The mandate states that they have to provide the coverage, but it does not limit how much they have to charge for coverage. This could cause private insurance to no longer be competitive and force them out of the market altogether. Finally, let's talk about what we can do to stop the Affordable Care Act. First, we have to stop believing everything we see on TV. Most of us have probably noticed a commercial or two talking about the potential benefits of the act. However, these commercials have drawn criticism by the minority staff of the House Oversight and Government Reform Committee for engaging in inappropriate public relations and propaganda activities. Next, talk to your personal trusted healthcare provider and ask them if they support the Affordable Care Act. Dr. Michael C. Burgess, who is a member of the House of Representatives as well as a family physician, states in his 2011 book, Doctor in the House, that in November 2009, CIRMO released polls showing that 92% of doctors thought the bill failed to address the real sources of cost increases in healthcare, and 94% did not believe the current reform plan would actually reform healthcare. Finally, Dr. Burgess also reports in his book, Doctor in the House, that the bill was rushed and originally written as a housing bill. However, the housing language was removed by the Senate and healthcare language was inserted. This is unacceptable for a bill that is so important to every person in our nation. Call your congressmen and women today and let them know you support the Affordable Care Act being repealed and being carefully reconstructed by true, respected healthcare professionals and not a bunch of bureaucrats. Today I've relayed to you the current struggles providers are facing because of the Affordable Care Act, what challenges you can expect to face in the near future, and how you can help stop this damaging bill from ruining our healthcare system altogether. I encourage everyone to take responsibility for their own health care by researching the ramifications of the current healthcare reform plan. Without our voices uniting together, telling our Congress we want control over our own health care, medicine as we know it will change forever.